I think that we are basically, as a result of the study, coming to the end of an era in cancer therapy. I think that this study is going to mark the end of the routine use of whole brain radiation therapy for the treatment of patients with metastatic brain cancer. And it's going to usher in an era of very sophisticated, novel, focused therapies for taking care of these patients. The protocol randomized patients to a group that was receiving focused therapies alone, stereotactic radiosurgery, versus stereotactic radiosurgery plus the whole brain radiation therapy. And then we analyzed survival, functional independence, quality of life, neurocognition, ability to think and do other things. And we looked at that over a multi-year period. It took several years to gain the data. In fact, in patients who were receiving whole brain radiation therapy, we were seeing fewer lesions at later time points, which was good. The interesting thing was it really had no impact on their survival. So they weren't living longer and they weren't having fewer symptoms. They were, however, having increased symptoms related to the effects of the whole brain radiation therapy. They were having side effects. They were having problems with neurocognition. They were having problems with decline in quality of life. As a result of this study, we're already seeing a renewed emphasis on the analysis of focused therapies for brain cancer. And what do I mean by that? Instead of treating the brain globally, using very precise techniques such as minimally invasive surgery, such as focused radiation therapy, in certain instances using laser therapy to use heat to control these lesions. The concept was developed in our local cancer community. It was ultimately presented to the National Cancer Institute. We received funding for it. It's been administered in multiple treatment areas around the country. I'm the co-principal investigator of the national study. Paul Brown, who's a physician at MD Anderson, very, very bright gentleman and a radiation oncologist there, is the other co-principal investigator. He recently presented the results of this study at ASCO, which is the world's largest oncology meeting. It was extremely well received. A lot of interest was generated, and we think that this really is going to change the pattern of care. We're understanding this has to be a routine part of care now, asking patients what their experience is like in multiple dimensions. For a cancer patient, is it important that they live longer? Absolutely. But it's also important that every day they feel like they're experiencing quality of life. And so we have to optimize not only the survival piece, but also the quality of life piece. But you're going to find these sets of questions and these sets of analyses transforming medicine as we know it.